Question 1. Which of the following is the most critical factor for ensuring steam sterilization is effective? A. Package aesthetics. B. Proper documentation. C. Complete air removal from the sterilizer chamber and packages. D. Sterilizer loading capacity. Answer: C. Complete air removal from the sterilizer chamber and packages. The concept tested here is the fundamental principle of effective steam sterilization. The most critical factor for steam sterilization is the complete removal of air, because air pockets can prevent steam from reaching all surfaces of the instruments and inhibit the sterilization process. Without thorough air removal, cold spots can form, making the load sterile in some areas but not others, which poses a significant patient safety risk. Think of it like trying to boil water in a pot that has an air bubble preventing the flame from touching the bottom. The water won't heat evenly. Always remember that proper air removal ensures steam can penetrate and effectively sterilize all items within the load. Question 2. What is the minimum frequency for performing a Bowie-Dick test in a pre-vacuum steam sterilizer? A. Weekly. B. Monthly. C. Daily, before the first processed load. D. After every load containing implants. Answer: C. Daily, before the first processed load. This question focuses on the essential quality control measure known as the Bowie-Dick test for pre-vacuum steam sterilizers. The keyword minimum frequency highlights the baseline requirement. This test must be performed daily, specifically before the first processed load of the day, to ensure the sterilizer is properly removing air and that steam is penetrating effectively. Failing to perform this daily test could mean that subsequent loads are not truly sterile, putting patients at risk. Imagine checking the oil in your car every morning before a long drive. It's a critical pre-use check to ensure the system is working as intended. Always remember that the Bowie-Dick test is a vital daily guardian for pre-vacuum steam sterilizer performance. Question 3. When loading a steam sterilizer, what is the primary reason for placing items on their edge or in a manner that allows condensation to drain? A. To prevent items from shifting during the cycle. B. To conserve space within the sterilizer chamber. C. To facilitate air removal and steam penetration, and prevent pooling of condensate. D. To allow for easier removal after the cycle is complete. Answer: C. To facilitate air removal and steam penetration, and prevent pooling of condensate. This question tests your understanding of proper loading techniques for steam sterilizers, with primary reason being the key clue. Placing items on their edge or allowing for drainage directly addresses the physics of steam sterilization. This method ensures that air can be completely removed from packs and that steam can freely circulate and condense on all surfaces, while also allowing condensation to drain, preventing wet packs which are considered contaminated. For example, if you place a bowl flat in a dishwasher, it will collect water and not get clean. Similarly, flat items in a sterilizer can trap air and condensate. Always remember that proper loading is crucial for effective air removal, steam penetration, and preventing wet packs, directly impacting patient safety. Question 4. What is the primary purpose of a biological indicator, BI, in a sterilization process? A. To confirm that the correct temperature was reached inside the sterilizer. B. To verify the time and pressure parameters of the sterilization cycle. C. To demonstrate that conditions were adequate to kill specific resistant microorganisms. D. To indicate the integrity of the sterilization package. Answer: C. To demonstrate that conditions were adequate to kill specific resistant microorganisms. This question focuses on the core function of a biological indicator, BI, in sterilization, with primary purpose guiding your answer. A BI contains highly resistant bacterial spores, and its purpose is to confirm that the sterilization process was effective enough to kill even these toughest organisms, thus verifying lethality. While chemical indicators show that physical conditions, like temperature or steam presence, were met, only a BI provides direct evidence of microbial kill. Think of it as the ultimate pass/fail test for the sterilization process, ensuring the equipment truly achieved sterility. Always remember that BIs are the gold standard for monitoring the effectiveness of a sterilization cycle. Question 5. Which of the following types of sterilization is characterized by a long aeration time due to toxic residuals? A. Steam sterilization. B. Ethylene oxide, EO, sterilization. C. Hydrogen peroxide gas plasma sterilization. D. Ozone sterilization. Answer: B. Ethylene oxide, EO, sterilization. This question asks about a specific characteristic of a sterilization method related to its residuals. The keywords long aeration time and toxic residuals are clear indicators. Ethylene oxide, EO, is a gaseous sterilant known for its ability to sterilize heat and moisture-sensitive items, but it leaves behind toxic residues on materials. Therefore, after the sterilization cycle, items must undergo a lengthy aeration process, typically 8 to 12 hours or more, in a specialized aerator to dissipate these toxic gases and ensure the items are safe for patient use. Consider it like airing out a freshly painted room. You need time for the fumes to dissipate before it's safe to occupy. Always remember that EO requires significant aeration due to its toxic nature, a critical step for patient and staff safety. Question 6. When processing a load containing an implantable device, what additional sterilization monitoring step is required? A. A Bowie-Dick test must be performed immediately after the load. B. A biological indicator, BI, must be placed in every implantable device load. C. The implant must be processed using a low-temperature sterilization method only. D. The processing record must be retained for a minimum of 1 year. Answer: B. A biological indicator, BI, must be placed in every implantable device load. This question highlights a crucial requirement for sterilizing implantable devices. The phrase implantable device is the key indicator here. When sterilizing items that will be permanently implanted into a patient, a biological indicator, BI, is absolutely mandatory for every single load containing such items. This provides the highest level of assurance that the sterilization conditions were lethal to microorganisms, because if the BI fails, the implant must be recalled and reprocessed, and the patient may need to be notified if already implanted. It's like having an independent inspector sign off on a critical piece of construction before it's used. Always remember that for implantable devices, a BI must be run with every load to ensure maximum patient safety. Question 7. What is the primary reason for wrapping or packaging items before sterilization? A. To make them easier to handle and transport. B. To protect them from contamination after sterilization. C. To identify the contents of the package. D. To keep items organized during storage. Answer: B. To protect them from contamination after sterilization. This question focuses on the main purpose of sterile packaging. The keyword primary reason helps you identify the core function. The packaging, whether it's a wrap, pouch, or rigid container, creates a sterile barrier that maintains the sterility of the instruments after they have been processed and until they are used. Without this barrier, items would be recontaminated immediately upon removal from the sterilizer, rendering the sterilization process useless. Think of it like sealing food in an airtight container to keep it fresh. The packaging preserves its integrity after processing. Always remember that the package's role is to maintain sterility and prevent recontamination of the instrument until it is used. Question 8. What is a wet pack and why is it considered contaminated? A. A pack that was accidentally dropped in water, making it non-sterile. B. A pack that feels damp after sterilization, indicating a failure in the drying phase, and it is considered contaminated because moisture provides a pathway for microorganisms. C. A pack that was improperly stored in a humid environment, leading to condensation. D. A pack that has not been properly sealed, allowing moisture to enter during storage. Answer: B. A pack that feels damp after sterilization, indicating a failure in the drying phase, and it is considered contaminated because moisture provides a pathway for microorganisms. This question defines a critical issue in sterilization known as a wet pack and explains its implications. The term wet pack specifically refers to a package that is visibly damp or has moisture inside immediately after the sterilization cycle. This condition indicates that the drying phase was insufficient, and moisture provides an easy pathway for environmental microorganisms to wick through the sterile barrier, recontaminating the contents. Therefore, any wet pack must be considered non-sterile and reprocessed entirely. It is similar to a Band-Aid that gets wet. It loses its ability to protect the wound and must be replaced. Always remember that moisture compromises the sterile barrier, making a wet pack unsafe for patient use. Question 9. In steam sterilization, what is the significance of superheated steam? A. It is steam that is too hot and damages instruments. B. It is steam that contains too much moisture, leading to wet packs. C. It is steam that has been heated to a temperature higher than its saturation point at a given pressure, which is undesirable because it behaves more like a gas and does not effectively transfer heat for sterilization. D. It is steam that has been mixed with air to increase its penetration capabilities. Answer: C. It is steam that has been heated to a temperature higher than its saturation point at a given pressure, which is undesirable because it behaves more like a gas and does not effectively transfer heat for sterilization. This question delves into a specific issue related to steam quality, specifically superheated steam. The key clue is understanding why this condition is problematic. Superheated steam is undesirable because it acts more like a dry gas than true saturated steam, which is essential for effective heat transfer and sterilization through condensation. When steam is superheated, it cannot condense efficiently on instrument surfaces, leading to insufficient thermal energy transfer and a potential sterilization failure. Think of trying to boil water with just hot air instead of actual steam. It wouldn't work efficiently. Always remember that proper steam sterilization relies on saturated steam, not superheated steam, for optimal heat transfer and microbial kill. Question 10. What is the correct action to take if a sterilizer fails a biological indicator, BI, test? A. Rerun the BI in the next load to confirm the result. B. Immediately remove the sterilizer from service, recall all loads processed since the last negative BI, and investigate the cause. C. Increase the sterilization cycle time for the next few loads. D. Document the failure and continue processing routine loads. Answer: B. Immediately remove the sterilizer from service, recall all loads processed since the last negative BI, and investigate the cause. This question addresses the critical response to a failed biological indicator, a core concept in quality assurance. The keywords sterilizer fails a biological indicator, BI, test signal an immediate and serious problem. If a BI indicates a failure, it means the sterilization conditions were not met, and any items processed in that sterilizer since the last acceptable BI could be non-sterile. Therefore, the sterilizer must be immediately taken out of service, all affected loads must be recalled, and a thorough investigation initiated to determine the cause of the failure. This ensures no potentially contaminated instruments reach patients. Consider it like finding a critical safety defect in a car's braking system. You would immediately stop driving it and recall all vehicles made with that defect until it is fixed. Always remember that a failed BI means an immediate recall and investigation to protect patients. Question 11. Which of the following is considered a Class 5 chemical indicator used inside sterilization packages? A. An indicator tape placed on the outside of a package. B. A multi-parameter indicator that reacts to two or more critical process variables. C. An integrating indicator that reacts to all critical process variables, time, temperature, and presence of sterilant. D. A single parameter indicator that changes color when exposed to steam. Answer: C. An integrating indicator that reacts to all critical process variables, time, temperature, and presence of sterilant. This question tests your knowledge of the different classes of chemical indicators used in sterilization monitoring. The key term Class 5 chemical indicator refers to a specific type defined by standards. A Class 5 integrating indicator is designed to react to all three critical variables of the sterilization process, time, temperature, and the presence of the sterilant, like steam, and is considered equivalent to a biological indicator in its ability to predict a sterilization failure. These indicators are placed inside packages to confirm that conditions were met within the pack itself. Think of it as a small, smart sensor that can tell you if all the necessary conditions for sterility were achieved inside your instrument tray. Always remember that Class 5 integrators provide a high level of assurance by responding to all critical sterilization parameters. Question 12. What is the recommended method for sterilizing heat and moisture-sensitive instruments, such as flexible endoscopes, that cannot withstand high temperatures or steam? A. Dry heat sterilization. B. Immediate use steam sterilization, IUSS. C. Low-temperature sterilization methods like hydrogen peroxide gas plasma or ethylene oxide. D. Immersion in high-level disinfectant. Answer: C. Low-temperature sterilization methods like hydrogen peroxide gas plasma or ethylene oxide. This question addresses the appropriate sterilization methods for delicate instruments. The keywords heat and moisture sensitive and cannot withstand high temperatures or steam are the critical clues. Instruments like flexible endoscopes would be damaged by the high heat and moisture of steam sterilization. Therefore, low-temperature sterilization methods, such as hydrogen peroxide gas plasma or ethylene oxide, are specifically designed and recommended for these delicate, heat-sensitive items, as they achieve sterility without high temperatures. This is similar to dry cleaning delicate clothing that would be ruined by water. Always remember that proper sterilant selection for sensitive instruments is crucial to prevent damage and ensure patient safety. Question 13. What is the acceptable maximum weight for a reusable textile pack designed for steam sterilization? A. 5 pounds. B. 7 pounds. C. 12 pounds. D. 25 pounds. Answer: C. 12 pounds. This question tests your knowledge of specific guidelines for preparing textile packs for steam sterilization. The keyword maximum weight is critical here. According to industry standards, like AAMI, the maximum acceptable weight for a reusable textile pack for steam sterilization is 12 pounds. Exceeding this weight can compromise the ability of steam to adequately penetrate to the center of the pack and can lead to wet packs or incomplete sterilization due to the density. Imagine trying to completely dry a very thick, heavy blanket in a dryer. It takes much longer and might not dry evenly. Always remember that pack weight directly impacts steam penetration and the effectiveness of the sterilization cycle. Question 14. After a steam sterilization cycle is complete, what is the correct practice for handling sterilized items upon removal from the sterilizer? A. Immediately stack items tightly on a shelf to save space. B. Place items on a cool surface or allow them to cool slowly on the sterilizer cart to prevent condensation and preserve package integrity. C. Transfer items directly to the sterile storage area for immediate use. D. Open all packages immediately to inspect instruments for sterility. Answer B. Place items on a cool surface or allow them to cool slowly on the sterilizer cart to prevent condensation and preserve package integrity. This question addresses the proper post-sterilization handling of processed items, a critical step to maintain sterility. The phrase "handling sterilized items upon removal" is the key. Items must be allowed to cool slowly and completely on a cool, sterile-compatible surface or on the sterilizer cart itself without being stacked. Rapid cooling or stacking can lead to condensation forming inside the packages, creating wet packs, which compromises sterility, or it can damage the packaging materials. Think of hot food taken out of the oven. If you immediately cover it, condensation will form inside. Always remember that proper cooling prevents condensation and protects the integrity of the sterile barrier. Question 15. What is the function of an air removal test, Bowie-Dick, in a steam sterilizer? A. To test the effectiveness of the drying cycle. B. To measure the internal temperature of packages. C. To detect inadequate air removal and presence of non-condensable gases in the chamber. D. To verify the growth of spores in a biological indicator. Answer C. To detect inadequate air removal and presence of non-condensable gases in the chamber. This question specifically asks about the purpose of the Bowie-Dick test, also known as an air removal test. The keywords air removal test and Bowie-Dick are direct clues. This test is designed to evaluate the efficiency of the air removal system in a pre-vacuum steam sterilizer by detecting if any air pockets or non-condensable gases remain in the chamber. If air is not completely removed, steam cannot adequately penetrate, leading to sterilization failures. It's like checking for air bubbles in a medical syringe before injection to ensure proper medication delivery. Always remember that the Bowie-Dick test is vital for ensuring steam can reach all surfaces for effective sterilization in pre-vacuum units. Question 16. What is the typical temperature range for steam sterilization cycles? A. 121 degrees Fahrenheit to 132 degrees Fahrenheit, 49 degrees Celsius to 56 degrees Celsius. B. 212 degrees Fahrenheit to 230 degrees Fahrenheit, 100 degrees Celsius to 110 degrees Celsius. C. 250 degrees Fahrenheit to 275 degrees Fahrenheit, 121 degrees Celsius to 135 degrees Celsius. D. 320 degrees Fahrenheit to 350 degrees Fahrenheit, 160 degrees Celsius to 177 degrees Celsius. Answer C. 250 degrees Fahrenheit to 275 degrees Fahrenheit, 121 degrees Celsius to 135 degrees Celsius. This question tests your knowledge of the fundamental parameters for steam sterilization. The keyword typical temperature range points to the standard operating temperatures. Steam sterilization cycles generally operate at high temperatures, typically ranging from 250 degrees Fahrenheit to 275 degrees Fahrenheit, 121 degrees Celsius to 135 degrees Celsius, under pressure, to effectively kill microorganisms by denaturing their proteins. Temperatures below this range would not reliably achieve sterility within the standard cycle times, while temperatures significantly above could damage instruments without additional benefit. Think of it as the specific cooking temperature required to make sure food is safe to eat. Always remember these critical temperature ranges as they are foundational to effective steam sterilization. Question 17. Which sterilization method uses a highly reactive form of oxygen to kill microorganisms? A. Ethylene oxide, EO. B. Hydrogen peroxide gas plasma. C. Ozone. D. Dry heat. Answer C. Ozone. This question asks about a specific low-temperature sterilization method. The keyword highly reactive form of oxygen is the direct clue. Ozone sterilization utilizes ozone gas, O3, which is an allotrope of oxygen, as the sterilant. Ozone works by oxidizing and destroying the cell components of microorganisms, effectively killing them. While hydrogen peroxide also involves oxygen, ozone specifically uses O3 generated from medical-grade oxygen. Think of ozone as a supercharged version of oxygen that aggressively attacks germs. Always remember that ozone uses a powerful, reactive form of oxygen for sterilization, offering a green alternative for heat-sensitive instruments. Question 18. What is the primary reason for performing a leak test on rigid sterilization containers? A. To ensure the container is aesthetically pleasing. B. To verify that the container can hold heavy instruments. C. To detect any breaches that could compromise the sterile barrier. D. To confirm the container is properly labeled. Answer: C. To detect any breaches that could compromise the sterile barrier. This question focuses on a crucial quality control step for rigid sterilization containers. The primary reason for a leak test is to ensure the container's integrity. A leak test verifies that there are no cracks, pinholes, or improper seals that could allow microorganisms to enter the container after sterilization, thereby compromising its sterile barrier and rendering the contents non-sterile. This test is essential because even microscopic breaches can allow contamination. Imagine trying to keep water in a bucket with a tiny hole; it will eventually leak out. Always remember that a leak test on rigid containers is vital for maintaining the sterile barrier and preventing recontamination. Question 19. What type of physical monitor can indicate that a sterilizer reached the correct temperature and pressure, but does not confirm microbial kill? A. Biological indicator, BI. B. Chemical indicator, CI. C. Recorder printout, chart or tape. D. Integrator. Answer: C. Recorder printout, chart or tape. This question distinguishes between different types of sterilization monitoring. The key phrase is indicate that a sterilizer reached the correct temperature and pressure, but does not confirm microbial kill. A sterilizer's recorder printout, often a chart or digital display, provides a physical record of the actual time, temperature, and pressure achieved during the cycle. While it confirms that the physical parameters were met, it does not directly verify the death of microorganisms. That is the role of a biological indicator. Think of it like a receipt showing you paid for a service, but not a guarantee of the quality of the service itself. Always remember that physical monitors provide a record of cycle parameters, but BIs are needed to confirm microbial lethality. Question 20. When preparing instruments for sterilization, multi-part instruments should be: A. Assembled completely to ensure proper sterilization of all components. B. Disassembled as much as possible to allow sterilant to contact all surfaces. C. Loosely assembled to prevent loss of small parts. D. Processed separately from their components. Answer: B. Disassembled as much as possible to allow sterilant to contact all surfaces. This question focuses on the proper preparation of complex instruments for sterilization. The key concept is ensuring sterilant contact with all surfaces. Multi-part instruments, especially those with lumens, hinges, or intricate designs, must be disassembled or opened to their fullest extent. This allows the sterilant, steam, gas, etc., to directly contact all internal and external surfaces, ensuring that no areas are shielded and all microorganisms are exposed and killed. If parts are assembled, some areas might not be reached by the sterilant, leading to an incomplete sterilization. Imagine trying to wash dishes with food stuck underneath a closed lid; it won't get clean. Always remember that disassembling multi-part instruments is crucial for thorough sterilant penetration and effective sterilization. Question 21. What is the primary risk associated with using immediate-use steam sterilization, IUSS? A. It requires specialized, expensive equipment. B. It has a higher chance of instrument damage due to rapid processing. C. It bypasses many quality assurance steps, increasing the risk of patient exposure to non-sterile instruments. D. It has a longer cool-down period compared to other methods. Answer: C. It bypasses many quality assurance steps, increasing the risk of patient exposure to non-sterile instruments. This question addresses the significant concerns surrounding immediate-use steam sterilization, IUSS. The keyword primary risk points to the most critical drawback. IUSS is intended for urgent situations when there's no time for standard sterilization, but it often bypasses critical quality assurance measures like complete drying, sterile storage, and biological indicator results being known before use. This significantly elevates the risk of using a non-sterile instrument on a patient, which can lead to surgical site infections. Think of it as a rush job that skips essential safety checks, potentially compromising the outcome. Always remember that IUSS should be minimized due to its inherent risks and used only when absolutely necessary, never for convenience. Question 22. What is the purpose of placing a chemical indicator inside every sterilization package? A. To identify the contents of the package. B. To prove that the package was exposed to the sterilization process on the outside. C. To verify that the sterilant penetrated the package and reached the instruments inside. D. To confirm that the package is completely dry after the cycle. Answer: C. To verify that the sterilant penetrated the package and reached the instruments inside. This question clarifies the specific role of an internal chemical indicator. The keyword inside every sterilization package is the crucial clue. While an external indicator tape confirms that the package went through the sterilizer, an internal chemical indicator provides evidence that the sterilant, e.g., steam, successfully penetrated the packaging material and reached the instruments within the load. This is a vital check, especially for dense or complex packages, to ensure proper exposure and effective sterilization of the contents. It's like checking the temperature inside a roast to ensure it's cooked through, not just relying on the oven temperature. Always remember that the internal chemical indicator confirms sterilant penetration to the actual instruments. Question 23. Why is proper air removal from packages crucial for effective steam sterilization? A. To prevent packages from floating in the sterilizer. B. Air pockets can create cool spots and prevent steam from reaching and sterilizing all surfaces of the instruments. C. To reduce the overall weight of the package. D. To allow for easier handling of hot packages. Answer: B. Air pockets can create cool spots and prevent steam from reaching and sterilizing all surfaces of the instruments. This question reiterates a foundational principle of steam sterilization, emphasizing proper air removal from packages. Air is a non-condensable gas that forms cold spots, acting as a barrier that prevents steam from coming into direct contact with and effectively sterilizing instrument surfaces within a package. For steam to effectively transfer its lethal energy, it must condense on the cooler surfaces of the instruments, and air impedes this critical process. Imagine trying to heat a room with a blanket blocking the heat source. The blanket prevents heat from reaching the air. Always remember that trapped air is the enemy of effective steam sterilization, leading to potential sterilization failures. Question 24. Which of the following defines the event-related sterility concept? A. Items are considered sterile indefinitely until a specific event compromises their integrity. B. Items remain sterile for a fixed, predetermined shelf life, e.g., 30 days. C. Sterility is maintained only if the package is stored in a sterile environment. D. The sterility of an item is only guaranteed until it leaves the sterile processing department. Answer: A. Items are considered sterile indefinitely until a specific event compromises their integrity. This question asks about a key principle related to sterile storage and shelf life. The term event-related sterility is the direct concept being tested. This principle dictates that an item remains sterile as long as its protective packaging is intact, uncompromised, and dry, regardless of how much time has passed since sterilization. It shifts the focus from an arbitrary expiration date to whether an event, like dropping, tearing, or wetting the package, has compromised the sterile barrier. Think of a can of unopened food. It remains good until the can is dented, rusted, or opened, not just after a set number of days. Always remember that event-related sterility means the package integrity, not a date, determines sterility. Question 25. What is the primary goal of quality assurance (QA) programs in sterile processing? A. To reduce operational costs by optimizing sterilizer usage. B. To ensure all staff members are cross-trained on all equipment. C. To monitor and verify that sterile items consistently meet pre-established standards for patient safety. D. To track inventory levels of sterilization supplies. Answer: C. To monitor and verify that sterile items consistently meet pre-established standards for patient safety. This question focuses on the overarching purpose of quality assurance in sterile processing. The keyword primary goal guides you to the most important objective. The main purpose of a QA program is to systematically monitor every aspect of the sterile processing workflow, from decontamination to sterilization and storage, to consistently ensure that all instruments and supplies are truly sterile and safe for patient use. It's about preventing errors and maintaining a high standard of quality. Think of it like a meticulous chef consistently checking every ingredient and step to ensure every dish meets a high standard of taste and safety. Always remember that quality assurance in sterile processing is fundamentally about ensuring patient safety through consistent, reliable sterility.